My name is Renee Blackman. I'm a Gubby woman from the Sunshine Coast originally, and I'm the CEO of ATSICHS Brisbane. And I've been here for about a year, and I get the privilege, I guess, of leading us into the 50th year celebration. Look, a lot of things I've seen over the years. It's in the Aboriginal Torres Strait Islander community controlled sector. This isn't my first gig. I've worked in this sector for probably the last 15 years. So I have seen some of the things that ATSICHS Brisbane or ATSICHS Brisbane have done over those years. I think there's a lot of proud things. I mean, there's the expansion of the medical clinics or the primary healthcare clinics. There's the taking on of the Aboriginal Torres Strait Islander community-controlled kindergartens. Without ATSICHS Brisbane, we wouldn't have those. They would have been lost to some of the mainstream organisations. We've expanded on our elder care, so, making Jimbalunga, our aged care home, a lot bigger to take 77 beds. So there's been a lot of things over the years that I've seen since I've worked in the Aboriginal Torres Strait Islander community-controlled sector that make me very proud to be associated with ATSICHS Brisbane, and it's an absolute privilege being the latest caretaker of this role.
I enjoyed every day working at the centre. We had about 63 staff there at the time. We're in the old brick building in Hubert Street, and we had the Innovative Youth Health Service. We got some funding through ATSIC and Commonwealth Health to buy the building at the back of us and knock down the two buildings and build a new centre. But at the same time as we were building the medical centre, we also are building the Jimbalunga nursing home out at Eagle Peak. And initially the board of directors copped a bit of flack because they said, we're supposed to look after our own people at home. And the board said, no, health conditions are getting a bit more complex now, and our elders need more care. And so we opened the nursing home out there at Jimbalunga as well. And Auntie Pam Mam was one of the early founders of this place here. And so the board put into the council to get the street named after her, Pamela Mam Drive.
We had that cultural figurehead to make sure that how Jimbalunga operated was going to be culturally safe. And at the time, I think there was only about 50% of residents were Indigenous, and that's because a lot of time we kept our people at home. But over time, that's changed. The other thing was just after working in the public sector, and it's so inflexible, just working with, it was a team. It was good to go to work because we were working with other Murrays, in an environment where we're a community as well, so working for the community, and so the job satisfaction.
Yeah, during that 5.5 year period, there was a whole range of change happening and reform within the sector. We had the Close the Gap come along, and in South East Queensland, the Institute for Urban Indigenous Health had started up. Whenever you go to an organisation, I guess, your aim is to follow in the footsteps of those who went before you. So I feel really honoured to be part of the ATSICHS family and history. And at the end of the day, my aim was really to provide some stability to the organisation and to really, I guess, make sure I added value and made a difference to the organisation moving forward. I can sort of remember my meeting with the board and really telling them that I was initially there for 6 months, and I sort of went, it's not going to take 6 months, it's going to take 6 years. But in the end, I guess my time there was 5.5 years, and I was really, really happy with what was achieved during my time at the organisation. As an organisation, we changed the way we did things. We introduced the model of care, and we saw all of the services that we were providing to the community substantially improve and increase. So we went from 264 health checks per annum to over 4,000 health checks annually. We went from 9,800 visits to GPs annually to over 38,000.
From the day that I started, I went to a meeting in Dongas, and there was a building site, and we didn't have any new buildings, so that was a really exciting thing that was happening for our old people and for the organisation as a whole. We commenced running Burriga Kindy. Uncle Martin Wadigo had gotten ill, and so the elders came, Auntie Louise and Auntie Dot came and asked us if we could do some support in running Burriga Kindy so that it didn't have to close. So that sort of put us on the path then to becoming an approved early childhood provider, and that's when we started kindies. Those people from community, Auntie Mari Conlon as well, we had to secure Joyce Wilding Hostel and make sure that we didn't lose that site for our people. That had been established by Neville Bonner. Opal, One People's Advancement League. If we hadn't have done that, we would have lost that service, and same about Burriga Kindy too. If we hadn't have stepped in, we certainly run the risk of losing that service in community.
Let's celebrate a legacy that we're leaving behind us. There are CEOs before us, there are chairpersons, there are founders, that have created such a great foundation of an organisation for us to build upon, and what we are is privileged to be able to carry on that legacy, to be able to carry on and make that foundation stronger or build upon it, if you like. So yes, happy birthday, and it's been a great 50 years. Let's look forward to the next.